Type 1 diabetes, also known as T1D, affects 1.9 million Americans of all ages. Testing is available, of course. However, a new survey from the Diabetes Leadership Council reports that 2/3 of parents are unaware that T1D can be detected before symptoms even occur. So here this morning to share more about the screening and early detection are Dr. Desmond Schatz, professor, and medical director from the University of Florida, go Gators, and Dr. Anastasia Albanese O'Neill, Associate Vice President of T1D Education and Clinical Implementation at JDRF International, whose children also participated in T1D. So thank you for joining us today. Such an important topic. But let's first talk about the difference between type 1 and type 2 diabetes and what we should be watching out for.
No, that's a great question, and thank you for allowing me to share a little bit about the different types of diabetes. Type 1 diabetes is the relatively less common type of diabetes that we hear about in the news. It accounts for about 5% of diabetes in the United States, but as you noted, it does affect millions of people and certainly millions of people worldwide. What are the differences? Well, type 1 diabetes is autoimmune, which means the body's own immune system attacks and destroys the insulin-producing cells, and that person can't make any insulin. People with type 2 diabetes can still make their own insulin. Their body just has trouble using it. So what are the sort of downstream effects of that? Well, if you have type 1 diabetes, you have to replace insulin. There are no other options. But people with type 2 diabetes can do a number of things. They can change their lifestyle, increasing exercise or changing diet, which might get their blood sugar levels back to normal. They can take pills or other medications. But for people with type 1 diabetes, insulin is really the only option. And the other thing that I will say that isn't really commonly known is type 1 diabetes, most people don't have a family history. About 90% of the time it comes out of the blue. But people with type 2 diabetes, they can point to all kinds of people in their family, sisters and brothers and parents and grandparents who have diabetes. So again, they're very different types in terms of the cause. And that's why we're really thankful to get the word out. Because type 1 diabetes often comes out of the blue, people aren't expecting it, so you need to know the symptoms. If you are extremely thirsty or your child is thirsty, if you're going to the bathroom frequently or losing weight and can't explain that, often in kids, they might wet the bed at night suddenly after they've been potty trained for many years. That's a sign that you need to contact your doctor and ask about type 1 diabetes.
It's so interesting. And Dr. Schatz, who's at risk for type 1 diabetes and who can benefit most from the screening?
So the risk of developing type 1 diabetes in the United States is about 1 in 300 in the general population. When we look at family members, that risk is increased really 15-fold, so that it's no longer 1 in 300, but indeed 1 in 20. That 1 in 20 is a high risk, and if you've got one family member, it's really important that we know about another family member. The risks are a little different, slightly higher in offspring of fathers compared to mothers, but overall that risk is 1 in 20. So the importance of this is that now we have tests to be able to identify such people. And for several years we've developed tests called autoantibodies. That's really the smoke of a fire that's going on in the pancreas. And those autoantibodies can predict the subsequent development of type 1 diabetes. And this can occur weeks to months to many, many years beforehand. And that gives us an opportunity to do several things. It gives us an opportunity to make families aware of an impending diagnosis, to prepare for it. It can allow us to avoid hospitalizations with diabetic ketoacidosis. And in the United States, it's still almost 50% of new onset patients are being diagnosed with diabetic ketoacidosis, which involves a morbidity, meaning that you have to be admitted to hospital, you have to often be admitted to an ICU, it is costly, and it also has a negative effect, obviously, on the patient and the family. Well, we can prevent that by knowing this and by informing the family and by if necessary, arranging for that diagnosis and intervening early.
Yes, well, thank you so much for that. Where can we go for more information on testing and early screening?
There is several websites, but Getting Ahead of type 1 .org is one of the websites. Going to the TrialNet website, trialnet.org, will give information about testing. Speaking to your physician will enable them to either do the testing there in their clinic, if able, or else they can, once you go to that website, they can also, we can send you kits, which you can go into a local lab, or even get testing on blood spots. But there are several opportunities, and again, speaking to your physician or going to any of these websites will enable you to do that.